Now, earlier on, we chatted with Dr. Ridwan Mia, the reconstructive surgeon who helped save critical burn victim Pippie Kruger's life. Now, he is back to show us a demo of how some of his cosmetic procedures work, but please be advised that the following segment is not advised for sensitive viewers.
With summer around the corner, everyone is out there becoming more body conscious and is on a mission to achieve that perfect summer body. Now, sometimes we may need a little bit of medical help along the way, and renowned plastic and reconstructive surgeon Dr. Ridwan Mia is here to tell us about a few of the procedures to get us on our way. Dr. Mia, so happy that you're still here with us.
Thank you.
Okay, so I'm nervous. Summer's here. I am not ready. What are some of the procedures that people might think of doing to get themselves summer body ready?
What we see is this time of year there's a spike in requests for breast augmentations. People want to have that bikini body ready. They want to have the breasts lifted or augmented, made bigger. Liposuction, people just trying to contour their bodies, so they've worked hard and got rid of all the fat that they've accumulated in the winter months, and now they want to get that beach body ready. So we do lots of liposuction to get the curvatures of the body nice and ready for the beach. Around the thighs, around the tummy, getting rid of those love handles, that sort of thing. And it ranges. Some people use the holidays, especially because our summer holidays are at the end of the year. They use that bonus money, and they use the holiday period being off work to do things like their noses. And then more superficial treatments, or what we call non-invasive stuff, like your neurotoxins to inject into the face to take away those wrinkles or prevent them from becoming established. We do a lot of rhinoplasties, so nose jobs. Wow. And then also we have filler materials, so get the volume in the lips up, around the cheekbones. Subtle things that'll make you look younger and nicer. Boost your skin, for example. We do a lot of skin boosting treatments as well that you can inject and give you a younger, fresher look without people really realizing that anything's radically different.
I feel like I'd want to have you on speed dial for some reason, just saying. Okay, so you've got a model here, Chanel Pulser. Hello, Chanel.
Hi.
And you are going to be trying out your neurotoxin or filler treatments on her. Restylane. And how does the method work? What are you actually going to be doing?
Essentially, with the neurotoxins, we're going to be injecting areas like her forehead, which will prevent the wrinkles from becoming established as she ages. She's still got a young, healthy face, and we want to make sure that she stays that way. We're also going to be injecting her chin, which will prevent the what we call pebble stoning appearance that happens when you pout, for example. And then also, then we're going to be using skin boosters. Unfortunately, Chanel has a scar on the right cheek, which is giving her some asymmetry on her lips. Okay. So we're going to be using some skin boosters to boost the skin and revitalize it so the scar will become less visible, help the collagen underneath to develop better, and at the same time we're going to inject her lips to give her some extra volume and give her a nice, healthy-looking model looks for her lips.
Well, she seems ready. She's exciting, she's glowing, and her face has already had a numbing cream put on. It's been on for like the last 20 minutes, so shall we begin?
Yes, we can.
Here we go. I've never seen this done on live TV, so this is going to be interesting.
Okay, so we're going to start by just doing some treatment on her forehead. So, just going to do this for you.
So what are you currently doing there?
We're just using some alcohol to clean the surface of the skin, so that we don't have any risk of infection. Of
course, all right. There we go. And Chanel, you're not afraid of needles, right?
I am a bit, but
are you?
I trust Dr. Mia.
You're in good hands. You're in very good hands.
Okay. So what we're going to do now is sequentially inject different areas of her forehead. So I can just ask you to raise your forehead for us, raise your eyebrows, and bring them down as if you're frowning all the way down. There we go. So you can see those wrinkles that are developing on the forehead. So we're going to be targeting those areas so they don't become established later.
Right. Okay, no, definitely don't want them to become established. So Dr. Mia currently injecting Chanel in the forehead there, getting rid of those frowns. No one's ever going to say, turn that frown upside down after this. Wow. Is it painful at all, Chanel?
It's just a slight uncomfortableness, but nothing that you can't handle.
Nothing that you can't take.
There we go. And that, of course, is going to... Wow, that one looked hectic. And apparently, approximately how many of these injections would you put there, Dr. Mia?
It just depends on the nature of her frown and how much of the lines become evident when she raises her eyebrows.
Yeah.
The one thing we don't want to do is paralyze too much so that her eyebrows fall down.
Yeah.
You know, we want her to be able to still have the ability to move her eyebrows, but at the same time not have a completely paralyzed or frozen look. So we'll be giving her about 6 to 8 on each side.
And how often will she have to have this done? For
Generally between 4 and 6 months.
Okay.
So I'm going to come across to the other side.
Wow. There's a few bommels there, but I'm sure that will calm down.
It takes about half an hour and then it should resolve.
Okay.
So.
How you doing there, girl? You're like my hero right now, because I'm like, woo! Alrighty. What about crow's feet? For somebody that suffers with crow's feet a lot, would you be able to handle that?
You can inject those areas very nicely.
Yeah.
Chanel doesn't have those, but we certainly can do that.
Yeah. And also a big one I know is bags under eyes.
We would use filler a lot for that.
Okay.
And generally it would lead up to surgery eventually a procedure called blepharoplasty, where you would tighten up the eyebrow.
Because that's a massive situation. Once those bags are there, it's very difficult to take them away, yeah? Okay, now we're going into the chin.
And you can see it's just small volumes.
Yeah.
And
how many of these do you do a day, Doctor?
It just depends. On average, especially as you're saying in the summer months, people becoming more conscious and aware of the holiday period coming up and what they're going to look like. Yeah. So between 5 and 6.
Okay. There we go. She's done quite well. Chanel, legend.
So that's our neurotoxin injected. We're now going to start with the fillers.
Okay, there's more. While Dr. Mia continues with his procedure on Chanel, let's go and find out what else is happening on your Feel Good Breakfast Show.